Good morning, everybody. Welcome to the Bryan briefing on January the 5th. I'm John Woodrich, CEO of Bryan Medical Center. First of all, thank you all for masking, social distancing, and continuing to wash your hands. It is making a difference. I think you all heard we were very concerned about holidays and spikes, and at least the early signs is that we've had some very good compliance. So thank you to all of you. Thank you to the media to continue to cover all the information about COVID. Start with our census. We're at 506 today, 87 COVID patients in-house, 64 of those positive, 18 still recovering. We have 18 people in our ICU, 22 in our PCU, 47 in our general care unit. 13 of those individuals on ventilators, and then to share with you some information about the counties that these individuals are from across Nebraska into Kansas and actually over into Iowa. But for the real good news, we really want to share with you about the vaccine. I think you've heard a lot on the news and about the administration of it. We're extremely proud of what the staff have done here to get the vaccination in individuals, and it's making a tremendous difference. So what you're going to see here is a slide of how we're administering it, first doses and second doses throughout Bryan Medical Center, and here's some of the individuals that are receiving those vaccines. It's been a lot of planning. There's a lot of logistics behind this in assuring that we properly get people vaccinated, as well as scheduling them for their second doses as those become available. So I'd like to share with you some of those numbers. So far to date, we have done the first dose or administered the first dose to 4,519 people. That was as of 5 o'clock last night. Just under 3,600 of those individuals were employees within our system. A little over 900 were providers throughout the community and advanced practitioners and nurses that work in different offices within the community. We started administering the second dose of the Pfizer vaccine, and as of 5 o'clock last night, over 600 people have received their second dose of the vaccine. So to date, a little over 5,100 vaccines have been administered. We will continue to vaccinate people as the vaccines become available. We continue to work with our health department. We work with our other healthcare systems throughout this community. I want to give a lot of credit to the other organizations that have worked very collaboratively as we continue to work together to take care of the other practices throughout this community. I think you've seen a lot on the news. There's a lot of prioritization that's happening of taking care of healthcare workers, folks in nursing homes, assisted livings. You know, you think about dentist offices and a variety of others. And there are plans in place that as the vaccine comes available, we'll continue to roll that out. I think you heard the governor talk yesterday about identifying people 75 years and older. We've started to do that work and have presented those numbers to the state. So their anticipation is that within a number of weeks here, we will start to administer that. In the fashion that we do it is still undetermined. We're working through the logistics of how we will administer that vaccine. I will tell you, I got a report from the local health department yesterday that actually influenza is almost nil in the state, which is a really good sign. And we do believe some of these precautions that we have continued to do throughout COVID has really had an effect on not spreading influenza, so very good news from that aspect. So far, we have vaccinated over 67% of our employees. Realize that we just had opened up to what we call the third tier of 1A just before the holiday. So those people are scheduled within the next few weeks, and people are still signing up to get their vaccines. We have basically worked with the health department and said we will do whatever we need to do to get this vaccine out to people. We believe that's part of our mission, and I believe that's the mission of all the other healthcare systems you see. Whatever final logistics are set up, we will be there to help assist. If we're giving it here within our conference centers at the hospital, or we need to go to specific locations, we're going to do that and work together to get this vaccine out. Not to my knowledge. I think everybody's been reading that and what's happening in the UK. I think we just all are paying close attention to see if that's going to be a strain that this vaccine that we're currently giving is going to handle or not. I think it's just too early to tell at this point. We all would like to see it come here quicker. I think we're at the mercy of the suppliers of getting the vaccine. I will tell you, I believe this team is ready to ramp up as soon as we continue to receive more vaccines. So if it continues to get delivered to us, we will make sure it gets into individuals. You know, I'm very pleased at what's happening here at Bryan. You know, we purchased these Subzero freezers, and it's nice that we're not utilizing them that much, because as soon as we get the vaccine, we're trying to get it administered. So to me, that's a very good sign. We actually have phases identified. So there's a group of individuals in what we call Phase 1A. There is a Phase 1B and 1C. And right now we are through, or at least have notified the people all within 1A, and there's our tiers within the phases. So we are in Tier 4 of that, which is the final tier within Phase 1A. We're trying to stay as compliant across the state, because there is a prioritization to this of trying to take care of the first responders and individuals that will be most vulnerable. So I don't think leaving it up to organizations will create the continuity that we need to in taking care of the people at the highest risk. So I like that we have a system that's statewide in how we administer this. You know, I don't know. We've seen a definite drop in the number of individuals getting COVID testing, and we've seen that kind of happen across the state. So you wonder if it's just more people that are showing the signs, and so they are coming in immediately, instead of some that may have just stayed home and tried to weather through it. I really don't know the explanation behind the decline in the testing. We actually had not scheduled on the actual holiday, but did up to Christmas, as well as the weekends following Christmas and New Year's. Our whole goal, as I stated before, is getting this vaccination in people, because it really does no good if it's just sitting in a freezer someplace. So we're very committed to getting it administered. I think that depends on the notification that came out from the different entities that are administering the vaccine. I think we got our notice out to our staff and the providers in the community before the holidays and had time slots set up. And it could be just because some other entities did receive their doses late, and they probably waited to send out that notification. So running into the holidays could have caused a delay. I will just comment to you that I think the work of our health department and local officials was able to get us that vaccine at an early stage, and it's really helped us in the larger communities. But we really wanted to make sure the rural communities received theirs. And I know from a couple of the rural hospitals that we own and manage that they had received their vaccine just prior to the holiday. We have taken that into account as we administer it. A lot of our staff were being scheduled just prior to being off a couple of days. So in case if they did have side effects, they didn't need to miss work or would cause a scheduling issue for us. But I will tell you the side effects have been pretty minor. We're hearing soreness in the arm, some people low-grade fever, a little bit of achiness, but just have not seen any major side effects from the vaccine. I'm going to tell you, I'm still not confident we're past a peak. We are still being prepared for if we do see another spike occur. We don't want to be caught off guard. I think being cautious is probably the best thing we can do right now. We haven't opened up all elective surgeries. We will have that discussions with our medical staff as we continue to look at volumes. We have seen a little bit of an uptick probably in the last week, but nothing alarming to us. But we're just keeping our eye on it, and we'll make those determinations as we watch how the census goes over the next few weeks. I want to tell you, we do an allotment each day as we schedule people and as we thaw out the vaccine. If we come to the end of a day where we may have some doses left over, we start calling those individuals that may be signed up for the following day so that we do not waste a dose. So we're very cautious in our planning and how we do this so that we don't run into that type of situation here at Bryan.